Hi there, thank you so much for joining us. And joining me is Dr. David Morales. He's a pain interventionalist here at Nova Spine. Doctor?
Thank you very much.
You got it. The topic today, you're an expert on this, sciatica. What exactly is it?
Sciatica, in general terms, is a pain that usually is localized to the low back and it radiates down into the buttock and usually to one leg. It can go to both legs.
Is it constant pain, or is it kind of shooting, pain that kind of comes and goes?
It can be both. The main thing is that if it's shooting pain, it's more indicative of sciatica if it's more constant. But if they're causing disability, it definitely is something that should be looked into.
Okay, so someone is feeling that. When should they come see someone like yourself?
It's mainly if they're having disability dysfunction, if they're having interference with their workday, with driving, activities in the home.
Mm-hmm. And you diagnose it how?
So we'd like to always have imaging. First thing when they come into clinic, we ask them questions, because questions are very important to keep safe in general, and we also get imaging. And once we have that, we do a final exam. We examine the patient to confirm or deny if it's true sciatica. Very important.
Okay, if it is true sciatica, what's the treatment?
So we have four major categories of how to treat patients. We do provide out referrals for physical therapy to loosen up the muscles. We can provide medications also for pain. There is the option of surgery. We try to avoid surgery, but there's also injections. We're an interventional team.
Is that like epidural?
Yes, that is correct. That's one of the major treatments.
All right. And if surgery is in fact needed and you refer that out, how quickly does someone kind of bounce back to that quality of life?
It all depends on the severity of the sciatica and the prognosis that the surgeon does. But we always send to qualified surgeons who know exactly what needs to be done.
Doctor, great stuff. We appreciate it.
It's my pleasure.
Great information. And folks, we'll see you next time.
Thank you, Chris.